Urine Microscopics Review Part 2. So after viewing a slide on 10x, we then drop down to the 40x to view and enumerate the epithelial cells, red blood cells, white blood cells, bacteria, crystals, yeast, and other components such as sperm and artifacts. The epithelial cells, the purpose, they line the urinary and genital tract, multiple layers except for the renal tubules of the nephrons, and the outer layer of the cells are exfoliated and sloughed off into the urine. There are very few renal tubular epithelial cells that are seen in sediment typically, however, one or two is not abnormal. There are three types of epithelial cells. There's squamous, transitional, and renal. Identification may be difficult but clinically significant. Squamous epithelial cells kind of look like fried eggs. As an analogy, females oftentimes shed squamous epithelial cells from the urethra and the vagina, males the distal portion of the urethra. Normal urine sediment will have a few squamous epithelial cells per high power field. The presence usually indicates contamination of the urine specimen given from the vaginal or perianal areas from a female or the foreskin of the male. It is useful. We usually use the squamous epithelial cells as a focusing tool in the sediment with few microscopic structures present. So here's a picture of the squamous epithelial cells in this picture, and then also in this picture. Clue cells appear like fried eggs with rosemary sprinkled on them, as an analogy. They are vaginal in origin. These are epithelial cells that are coated with Gardnerella vaginalis, which the bacteria give a refractile, stippled, shaggy appearance to the epithelial cells. Bacterial vaginosis is usually diagnosed by vaginal secretion studies and are watery. There can be a watery, non-inflammatory exudate present in the patient. These cells lack polymorphic neutrophils, and vaginitis does not have any types of neutrophils present typically. Vaginitis will have the presence of clue cells, so it will have squamous epithelial cells with Gardnerella sprinkled. Oftentimes bacterial vaginosis will have a fish-like odor to the patient and will have an increase in pH, so a more alkaline pH. Transitional epithelial cells look more like poached eggs. They are 4 to 6 times the size of red blood cells. The shape in the bladder resembles squamous epithelial cells, become rounder and thicker until it is difficult to distinguish between them and renal tubular epithelial cells. Spherical with a distinct round or oval nucleus, and is capable of picking up water and swelling up like a balloon of water. They are binucleated cells that might be seen. They are not always binucleated, meaning they have two nucleuses. Some have tails of cytoplasm and are referred to as catiwate cells. Sternheimer-Malvin stain will then stain the nucleus bluish purple and the cytoplasm light purple, and the vacuoles, there might be vacuoles that might be present within these cells. Transitional epithelial cells, so normal in a few on high power field. The reason there might be transitional epithelial cells is types of drugs the patient might be on or an infection. Clusters or sheets may be seen in bladder washing or catheterization. Large numbers may be seen in neoplasms, so cancers. If the nuclei are irregular, refer for a cytological examination. Radiation therapy can also create large numbers. A large number of irregular multiple nuclei and vacuoles can be then seen. So here is a picture of a transitional epithelial. You can see the nucleus and then the oval type appearance with a lip. Renal tubular epithelium, we also think of as boiled eggs, is a layer of cells that line the proximal or distal convoluted tubules as well as the small and large collecting ducts. The appearance is a polyhedral in shape and elongated or ovoid with granular cytoplasm 3 to 5 times the size of a red blood cell and close to the size of a white blood cell. There is a distinct round nucleus and it has at least one flattened side. Sternheimer-Melvin stain will stain the nucleus a dark shade of blue-purple and the cytoplasm a shade of blue-purple. So renal tubular epithelium, strong evidence of active renal disease if there are greater than 15 renal tubular epithelial cells per high power field. Types of renal disorders, so acute tubular necrosis, viral infections involving the kidney, renal transplant injection, and drug or heavy metal intoxication. The rate of exfoliation is increased in fever, chemical toxins, inflammation and infection, and cancers or neoplasms. So here's a picture of a renal epithelial. You'll see the one flat edge, the very distinct nucleus, and that nucleus, the blue-purple, and also the cytoplasm areas, all one color. Clinical importance of the white blood cells is infection may enter the urine anywhere in the urinary tract from the male or female genital tract. Usually neutrophils are the most common white blood cell present, or polymorphic neutrophils. Any leukocyte that can be found in the urine is considered a white blood cell. Infections, so there can be a kidney infection, usually is accompanied by a moderate amount of proteinuria, so the chemical dipstick may have a positive white blood cell and also positive protein if it's a kidney infection. Bladder infections will have a minimal or negative protein on the chemical dipstick. And urethritis, which often is caused by sexually transmitted diseases, can also have a presence of white blood cells in the urine. The microscopic appearance of white blood cells, typical neutrophils, 10 to 12 uramils in diameter, almost twice the size of red blood cells, ideally a thin granular cytoplasm with a discrete lobed nucleus in fresh urine. Occasionally the leukocytes are dense, smaller, and their nucleus is hard to see, which is an indication of hypertonic urine. In dilute alkaline urine that is unrefrigerated, cells will swell and degranulate. Lobes may fuse together and indistinguishable from cells like lymphocytes or renal tubular epithelial cells. So here's a picture of the white blood cell. You can see the granular components among the cells. And here are some more white blood cells. Oftentimes when there are white blood cells present, you will also see bacteria, little bacteria is present. You can also see white blood cells in this slide, and you can identify them as their granulation. They are not concave or Structures confused with white blood cells, oftentimes red blood cells. Lymphocytes are the closest in size to red blood cells, and a single nucleus is present within the white blood cells. Renal, or a single nucleus, is oftentimes present in the lymphocytes. Renal epithelial cells generally larger with a small, more distinct nucleus, and there might be other structures that are present. So if there are white blood cells present, we talked about this a few slides ago, if there are white blood cells present, there are typically bacteria present. Hypotonic urine, neutrophils will swell and granules will exhibit Brownian's motion, which means granules, which we call these glitter cells. Sternheimer-Malbin stain, which will make the nucleus colorless or light blue, and the cytoplasm will then turn pale blue or gray. Clinically, glitter cells are associated with dilute hypotonic urine and may be seen in lower urinary tract infections or in chronic pyelonephritis. Red blood cells, the clinical significance, normal 0 to 2 per high power field. If there's more than this, it is called hematuria. Typically, red blood cells can be crenated in hypertonic urine, meaning a high specific gravity, or swollen, or a ghost cell if it's hypotonic or low specific gravity. So here's a picture of red blood cells, and you can see the concaveness of them. And here's another picture of the red blood cells in a swollen fashion. Some of these are a little crenated, meaning a hypertonic solution. These might be a little bit more swollen red blood cells, meaning a hypotonic solution. Bacteria, clinical significance. Under normal conditions, urine is free from bacteria, and few bacteria are present because of collection. Few bacteria might be present due to the collection technique if there is a little bit of contamination. So it's important to instruct our patients about the proper way to collect a urine specimen if it's a clean catch midstream urine, and the importance of wiping from front to back in 3 motions. A lower UTI has bacteria but will generally have fewer white blood cells present. An upper urinary tract infection will have bacteria but a lot of white blood cells present. So here is a slide with bacteria. We also have a squamous epithelial cell here, and it looks like this may be a red blood cell. I don't really see a whole lot of granulation, a little bit hard to tell. I would want to focus in on that one a little bit more to see what type of cell this was. Yeast, the clinical significance, more frequently seen in females and diabetics. Diabetics, due to the sugar the yeast like to feed off that. Females will oftentimes have a higher instance of yeast due to the moisture in the vaginal area. And yeast might be present because of the contamination of urine from a vaginal yeast infection. So here's a picture of yeast. They are whitish yellow in color, usually when seen under a microscope. Sometimes you will have the presence of bacteria around. And yeast also bud. We call this budding, where they grow, and they grow little links, and they link together. And here is a whole cluster of yeast growing, and then sometimes you will also have what's called a hyphae, which will grow out, and it will grow out little feelers like. Sperm, clinical significance may be present in both male and females. Report according to your lab protocol. Parasites, the most common parasite is Trichomonas vaginalis, most frequent parasite seen in the urine and responsible for vaginal infections. This organism is mobile. It has flagellum or a whip-like tail. And then it also has flagella, or I like to call these tentacles, like on the other end. So Trichomonas is a single-cell parasite causing vaginitis. When it is mobile, you will be able to see its undulating membrane and the flagella. Often you will see it among other cells within the specimen. This parasite can be transmitted between sex partners, but the male experiences no symptoms typically. And oftentimes Trichomonas is treated with a medication called Flagyl. Here are some pictures of some artifacts, air bubbles, a hairpiece. I'm not sure exactly what this is, but these are all considered artifacts, and a lot of times we don't report these. Calculating and microscopic analysis. Although the medical assistants do not read microscopic urinalysis, they must understand how the calculation and interpretation of this test is performed. By using the low power field, 10 to 15 fields are examined for casts. Casts are observed and counted on low power, but they must be identified on high power. 10 to 15 fields are then viewed under high power. Each substance seen in each of the high power fields is counted. When all the fields have been counted, the results for each substance are averaged and reported. Casts are reported as an average number seen per low power field, whereas cells are reported by using a numeric range based on the average per high power field. Other substances are reported as rare, few, moderate, or many. Sometimes we will report it as 1 plus 2 plus 3 plus 4 plus per high power field. And standardized counting and reporting system must be used by everyone in the same laboratory.